Welcome to the Tailor Method for Pain-Free Living, a podcast that features enlightening conversations with experts in the medical field that helps to improve the health and well-being of those suffering from chronic pain due to injury. Learn from leading authorities the questions you should be asking to experience pain-free living. Hosted by father and son, Dr. Derek Taylor and Dr. Hudson Taylor, and joined by industry professionals in the health field, including doctors of integrative medicine and personal injury attorneys. Enjoy well-rounded and informative conversations to help you get out of pain while achieving optimal wellness. Dr. Derek Taylor and Dr. Hudson Taylor are the doctors of Tailor Chiropractic and Laser Center in Florida and California. Both father and son duo have earned respect and a solid reputation for successfully helping people transform their lives by assisting them to discover the hidden causes of their painful health challenges, leading them to experience the resolution of their problems using the Tailor Method. Tune in each week to learn about the Tailor Method, Dr. Taylor's proprietary technology that looks at the whole person and identifies the root cause of pain while facilitating natural healing and helps to restore the body to optimal wellness without using drug injections or surgery.
Welcome to the Tailor Method for Pain-Free Living podcast. This is Dr. Derek Taylor. I'm here with Dr. Hudson Taylor. Last week we did a show on how the Tailor Method was, how it came about, and I thought about it afterwards, and I was thinking, what about Dr. Hudson Taylor? How did I get people asking me, how did you get involved in chiropractic? And some people have asked, hey, why does your son do what he does? So I thought we'd take this time for people, our audience, to get to know you a little bit better, son. And so let's start with you. Tell us about your story and why you're a chiropractor today and how you got involved with it.
Well, I was born and raised in a chiropractic family. Obviously, since you're my dad and I grew up being adjusted very soon after I was born, and I was adjusted pretty much every week of my life growing up, and really kept pretty much pain-free growing up. Whenever my brothers and I got injured in sports and just around the house, goofing off, we would throw some haymakers to each other as brothers growing up and just messing around and stuff. You just always be there to work on us right off the bat. And not only that, but learned really how to eat healthy through your kind of instruction growing up, and just mom making these great healthy meals. So not only just chiropractic getting adjusted all the time, but also just eating healthy and just staying healthy overall. So grew up with it, was raised with it. But I think the real turning point was after I got really seriously injured. So I played football, and my sophomore year of high school, I ruptured my ligament in my ankle during 2-day practice. And I was pretty discouraged, and I was, pretty disheartened when you look down and you see your ankle. It's the size of a grapefruit. So, we got an MRI and the ligament was completely ruptured. So, that was a kind of a season ending sort of a thing. And actually, our team, we considered canceling our football season because we didn't have enough players. But you got to work on me. You worked on me right away, treated me right away. And I was blown away because my ankle totally healed in like 2 weeks. And I got back on the field playing. It was like a miracle. And kind of there was kind of my turning point where, all my studies, for college and getting all my prerequisites in, I started taking college courses in high school and just getting the jump on getting into chiropractic school. And that became kind of my focus after that injury. And so that really sparked it. That really sparked it.
Hmm.
But I always kind of watched your example of just caring for people in pain, and not only just for your patients, but for our family. And there was something about just kind of caring for someone in need, and really just being able to bless someone, just by using your hands to help someone. And that was really inspiring and moving for me. And I found great fulfillment in doing that. So that's kind of things, one thing led to another. And next thing you know, I started a chiropractic school. And that's what really those are some of the things that really kind of drove me into the path of chiropractic. So.
Mm. Yeah, and you were, you were adjusted. I mean, from as a baby on throughout your entire childhood. I don't think you ever took antibiotics or a Tylenol, or we didn't have any medications or over-the-counter drugs in the house.
No.
And then you started working at the office at an early age, if you recall. I mean, you were cleaning the office, and then you started working and helping with patients. And you were working consistently at the office, but it really wasn't until you had the injury, the football injury, that, wow, that was a big turning point there for you. Seeing when I think you can, it's easy to take it for granted, chiropractic, when you're getting adjusted all the time, all your life. But then when you had that, there was that experience where you thought your season was done, and then you're back on the field in 2 weeks. And that was exciting for you, right? I mean, you were like, that's where things shifted. And that's when you realized that, hey, this is something that I want to do here. What was it that made you want to do that yourself?
Yeah, that's a great question. What was it that made me want to do it? Well, when it comes to it, I just kind of figured, look, I don't really know anything else. I I don't. I mean, I wasn't one to like. Nothing else interested me. I didn't want to go to a 4-year university and get some degree, a bachelor's degree in something that I wasn't really interested in. Um, I loved being active, and I loved, whenever something went wrong with like one of my brothers, I always try to be there just to kind of help them out. I found great fulfillment in that, because I it was either that or become a pastor, because I grew up going to church and everything, and not just that, but like I felt like when the Lord took hold of my heart when I was in middle school and showed me like how much I needed him, and just my need for Christ, and how Christ saved me. I just felt like, if I could help someone in that regard, and just be there to care for someone, that I found great fulfillment in doing that, as like did for me all my life. So I didn't nothing else interested me. Like I didn't find any fulfillment in getting any sort of other degree or doing any sort of other job. It just wasn't the same. It didn't quite meet the same satisfaction for me as like caring for someone. you
Yeah.
know
Yeah.
and that just really, you're kind of getting me going a little bit. It was hard for me to see people sick. I didn't like it when my family members and friends were not doing well, and they were sick and they were injured. And it like that, it moved me to kind of want to do something if I could. And I think I found when I realized, hey, this is what my dad has done all his life for us. And this is what he does every day. I want to be able to do the same thing. So that's when I kind of
Yeah.
took the step from there.
Yeah, I think you were born and you were kind of meant to do this kind of work. And so you started on a path of, you were homeschooled. And so you were able to start Harbor College. How old were you when you started Harbor College?
Yeah, no, I started when I started going to Harvard when I was 16, I think.
Yeah, somewhere in through
Yeah.
there. So
So
you started taking your college courses. And so you studied hard, you worked hard, and then you got all your chiropractic prerequisites done. And you were, what age were you when you entered into chiropractic school?
I was
You were
like a month
19?
away from turning 20. Yeah, so I was
So you
19.
started in the beginning of January. Yeah, just
Mhm.
a month away from turning 20. So you got a 3-year jump on me. I started when I was 23. And so I think you actually started Harbor like closer to 14 or 15. I don't think you were 16.
Oh, okay. I was a little
From
younger.
what I recall, you're a little bit younger. So you had a big jump and a head start. And then, you're the youngest guy in your class. Other people were in their early mid-20s and older. And so, but yet you excelled. I mean, you did great. I mean, you graduated at the top of class. You gave your salutatorian, you gave the speech, your graduation speech, which was uh such a blessing for your mom and I to see that and see how you've come to full circle. And then you graduated and you started working at the office. And then, what was that like graduating, going from
Mhm.
chiropractic school to reality, working on patients all the time? What kind of transition was like that for you?
Yeah, I was pretty comfortable when I graduated as far as just like knowing your office and
Yeah.
knowing having an idea of how you did things. I was fairly comfortable and just kind of like what to expect on the day-to-day basis. But man, you know, I look back when I first graduated and when I first started treating patients, and you know, I didn't realize like just really how much there is to, really just having the heart to serve a patient, and I didn't know anything what it was like to run a business. So when I first started um, and graduated, I just, for me, it was just kind of learning how to really take care of and treat a patient, which you modeled so well for me, and just kind of watching your example. It was a real, just kind of a watching season. I had the passion to do it. I loved doing it. All those things were there at that point. It was more like, okay, let me see how what it really looks like to take care of a patient, in the real world setting without any teachers there, without school curriculum, school guidelines. What is it really like to care for someone in the real world setting where it's all not controlled subjects coming in through the school system, So it was quite a difference there, you know.
So how do you practice differently now than you did compared to when you know, um, first graduated in, what was it, 2019 or?
Yeah, 2019. Yeah.
Yeah. How do you practice different now compared to then?
Well, I mean, let's see. When I first graduated, well, you know, you and I worked together a lot, and you took the lead on like guiding the patient and doing the exams and kind of meeting the patient and then figuring out what's going on and then getting them on the right plan. So you modeled that for me as far as how to do that, and I kind of watched. Um, and when I first started, it was like just learning how to treat patients. Well, um, now that you and the family moved to Florida, opened up another office, and I took over and running the practice in California. Now, you know, kind of what's different now is I'm kind of in that place as far as taking the patient from initial meeting to the maintenance phase where they're doing better, and they're kind of just coming in periodically. So just kind of overseeing all that, and it's definitely different when not only are you learning how to lead a patient and at the get-go, but also you have a team too that needs to do their job, and kind of serving not only the patient but serving the team as well. The staff of team members as far as them doing their job and taking care of the patients too. So it's definitely at a whole different level as far as you know uh, practicing in a practice to actually practicing and then overseeing the practice too. So
Mhm.
things have been exponentially different, but very very good, and what a blessing it is to do that every day.
So tell us how you have taken the Tailor method and kind of, you've made some improvements on it. You and I have had conversations over the phone. We talk about some of these things here. What tell us about some of the success cases that you've seen recently that you've been kind of like, it just happens with me as well. A lot of times you're just in awe when you see how God has given the body an amazing ability to heal itself once you remove the interferences and the adhesive scar tissue that's blocking these. Tell us about some of your most recent cases that you've had, that you've seen, that you're like, it never gets old, does it? I mean, you're just like,
oh no, it doesn't. I mean, just last night, we've been seeing a lot of people coming in with shoulder pain, and this guy here, this gentleman, he comes in and can barely move his arms, like that, and it's like, you can see how barely hot, how, there's barely any range of motion. And then, he experienced the Tailor Method treatment, and the Tailor Method treatment that he's never experienced before. He never had anything like this. And let's talk about the body's ability to heal. Like, you see about a 30% improvement after that alone,
Oh, dude, that's much better. That's huge.
So, it's like you see things like that, and that was just all on one night, and it's just a tribute to the body's just blessed ability to heal, but there, he never had, he had chiropractic, he had chiropractic, and he had physical therapy and cortisone shots and acupuncture, but, so cool to see after one Tailor Method treatment, the results that he got. And he's committed to the process. Not only is he going to be getting Tailor Method treatments for great improvement, but he's also going to be making some serious dietary changes and learning exercises too. And so, essentially just taking the Tailor Method and figuring out where to work and what the patient needs and what technology they need, and then what they need to do when they go back home, too. So,
yeah. And what are some other cases you like to work on and treat that you've seen consistent success with?
Yeah. So, we've been seeing a lot of shoulders, and then, a lot of knee pain as well. We've seen a lot of knee pain patients over the years, and man, that has been quite a joyful ride, as far as just seeing a lot of people with knee pain and just learning all about the knee and how to help people even work to avoid surgery if they don't want to go down that route, because there are a lot of people, they don't want to get the knee replacement, and just learning how to take care of that. We've seen great results with some pretty serious knee conditions too.
Have you had any kids, any athletes that are kind of in the same situation as you, where they didn't think they were going to be able to play, and then you got them back on the field here? Can you think of any cases?
Yeah, one gentleman, he injured his knee in football. He was a high school football player, so the quarterback, he sacked the quarterback, and the quarterback fell on his knee, and he heard kind of a pop. So he came in like the next day after the game, because they just wanted to do everything he could to get better, because when you're an athlete, you don't really care, like, what's going on. You just know you're in pain and that you want to get back on the field. So we just started treating him right away. I said, hey, I recommend you get the imaging done to see what's going on. I said, but hey, if you guys want to do everything you can to get back on the field, we'd love to assist you with that. So it was a real blessing just to assist that young man, and in taking him through the treatments, and then having him do the work as far as rehabbing and doing the exercises. And he really made some good changes and was determined to get back, and it was a real blessing to help him get back to that point. So he got back on the field in 3 weeks from that knee injury, and when he thought he was done for the rest of the season. So it was kind of like what you did for me when I got injured, and working with athletes, really awesome to see them get bounced back quick, because they're younger too. They're healthy, and they heal fast. And just all it really is just kind of just working with the body to help that the body heal in those situations. So yeah, we definitely had success with the athletes too. It's been
What
pretty
about the
awesome.
non-athlete? They're not necessarily an athlete, but they're maybe an older chronic case, degenerative
Mhm.
condition. They've been living in pain for a long time. What are some of the rewarding things you've seen working with some of these types of patients?
Mhm. Yeah, I I think let me think of one case in particular here. You know, when you get older, I mean, all you really want to do is, if you're not into extreme activities and sports, you just want to kind of be able to enjoy life, like, with your spouse, or do the fun hobbies that you love to do. Like I had one lady that just wanted to be able to walk around the block with her husband without feeling a ton of knee pain afterward. And she had a torn meniscus and a bone on bone knee. But she just wanted to be able to walk around the block with her husband without having pain. So, we took her through the knee protocol, and we started doing the shockwave therapy and the laser and the PMF, in the scar tissue work all over her knee and her hip and her ankle. And then she followed our metabolic weight loss program, and she lost like 20 pounds. And she got off her diabetes medication. She lost 20 pounds. Her knee really, the pain went down significantly. And her knee got a lot stronger too, despite the fact that her meniscus was torn, despite the fact that she had bone on bone. Then she was able to walk around the block with her husband, and she went even hiking in Yosemite for like 8 miles with him. 3 months after going through the knee protocol. So, those are really, really rewarding things to see. You
Mm,
know, and
yeah.
those are really, really rewarding things to see. Yeah.
Yeah. Well, what's in store for your future here? What do you see, what do you see more of here as we look at the days ahead?
Well, I think that the girls at the office, the team, they do such a good job. And I work with Dr. Laura, and a specialist and a massage therapist who's been trained in our techniques. So, just being able to like continue to treat patients myself, of course, but like being able to train them and teaching them, they already know, they know how to, a lot of the girls, the team members, they know how to take care of patients as well. And so just being able to further train them, being able to serve more people, being able to train other new team members in the future, and just working at just really expanding kind of what we do, and just giving the community something that a lot of people never experienced before. That's where I kind of see, God willing, just the future of Taylor Chiropractic, if we can keep, just really striving for good quality work, and using the Tailor method, but then teaching other people as well, how to do the technique to help more people. I think it would be really cool just to see more people helped. And that's kind of the I think the things to keep in mind for the future. So
Yeah.
and
Great.
and you opened up a clinic in Florida, and you're serving everyone out in Florida now. And Caden's coming up. My brother, your son, he's studying chiropractic. So it's really cool just to see Taylor Chiropractic being just kind of coast to coast. And I think it's something that everyone needs. So
Mm,
it's pretty awesome.
yeah. Great.
Yeah.
Well, I'm really proud of you, son. You've done an amazing job. You're far surpassed anything that I've done at this age, and you're doing such an amazing job at the office, and in Torrance is doing better than it has ever done before in the past. And that's a testimony to your hard work ethic. You've always been a hard worker. I mean, very disciplined, you methodical, really caring, you put in your time and it shows. And so, just what's coming to mind, I think about the time where your mom and we kidnapped you and your brothers, and instead of taking a left turn going up Silver Spur to Silver Spur School back in the day when you're going to Silver Spur, we took a right.
Oh yeah.
And we went to go, we got on the 110 freeway to go then to the 91 to go to Disneyland. And you kept on saying, we wanted to keep it a surprise, but you were like, I'm going to be late. I'm going to be late for my class. I'm going to be late. You were doing that for like 20 to 30 minutes. And we just said, finally, you're not going to school today. We're kidnapping. We're taking you someplace else. But we have it all on video. Maybe I'll have to put it on YouTube sometime.
No, don't put that on.
But that's just a testimony to how hard you've always worked and taken seriously your work. And I think we've talked about some things. You're doing some things, adding to the Tailor Method that's enhancing and making it even better. And wow, you're just doing great. It's amazing. I remember also when you were in the clinic in school, using the method there, your results were astounding even then, working with patients and your classmates and whatnot, just because this works. And so now you're taking it to another level. So I'm really proud of you. Keep up the great work. I love you, respect you, and let's go out there and continue to do our best to help as many people as we can using this great method of getting to the root cause by breaking up scar tissue and other issues. So keep up the good work.
Oh, thanks, Dad. I wouldn't have a clue about any of this stuff. I mean, you mentored me and you continue to, so I'm very grateful for everything you did. I don't know if I would have had that. I wouldn't have discovered the Tailor Method, obviously, if it weren't for being under your mentorship.
I think it was a gift from God, and it
was an absolute blessing.
Everything we've received, we've been given, and so
I
rejoice with that. And so
yeah.
Well, you got patients to treat, and so do I. So I think we need to sign off. But it's been fun talking about these things, and look forward to the days ahead.
All right, Dad. Absolutely.
All right. Well,
thank you.
This is Dr. Derek Taylor. I've been with my son, Dr. Hudson Taylor. We've been talking about his path and journey in chiropractic. And if you are in the Los Angeles area, give him a call at 310-891-0102. Or you offer free consultations out there. He'll let you know if he can or can't help you. But I couldn't think of a better doctor on the West Coast to send people to if you're in pain or you have an issue that you need to get rid of naturally. So anyway.
Well, same for you all on the East Coast, most definitely.
So right, this has been great. We're signing off, and we'll see you next time.
All right.
Thank you for listening to the Tailor Method for Pain-Free Living podcast. For more information about the Tailor Method and how you can find lasting pain relief, visit www.drderektaylor.com. That's www.drderektaylor.com.